What is up, everyone? How are you all today? It's great to be with you all this morning. We already have a number of people joining, which is great. We're going to give everyone just a couple more minutes, as is pretty standard practice, I think, at this point, to get into the room so we can get started. And while we do that, I always like to have a question. So feel free to chat this in so that we can, learn a little bit more about you. But I would love to hear from our panelists as well. If you could only be one place in the summer, doesn't have to be like a specific place, you should just be like the pool. But if you could only be one place in the summer, where are you choosing to be outside of, work? Because we know we have to be there still. So, but if you could only be one place, where would you be? Who's gonna go first? Who's gonna be bold here amongst our panelists?
We'll go first.
Ooh, great.
Do you want me to type it in or?
No, you can say it. Yeah, you're unmuted. So yeah, you say.
Okay, perfect. Well, I will be back home in the US Virgin Islands. I'm from the US Virgin Islands, and I would love to take a free vacation and spend some time back home and enjoy the sunset and the sea. So that is where I will be.
Sounds like you and Alice and Temeko maybe same. Sounds like on the beach.
Yeah, so all my beach friends
All your
will
beach friends.
enjoy together.
There you go. Cool. How about you, Ellie?
I'm staying away from the beach, mostly because the amount of sunscreen I go through is just not good. But my parents are actually visiting my aunt in Alaska right now, and I'm very jealous of that. And that's where I would want to be at
Awesome.
this summer, at this moment, anywhere but in the 98-degree heat here in North Carolina.
That is spicy for sure.
It's hot.
So yeah, it sounds like Ashley might want to join you in the mountains and go do a little bit of hiking. So love that. And how about you?
Yeah, I'd probably say hiking in the mountains as well. Swimming in the river or something like that. I did go to the beach this last weekend. It was hot.
Sounds good
So
until you get there, and then you're like, I'm already hot, and we've got a long time to go.
it's
So,
hot. It's hot. Yes.
all right. How about you, Deja?
Well, when I'm not pregnant, I would like to be on anybody's vineyard anywhere.
Sounds
Not my
lovely.
reality this summer, but maybe next year.
Sounds lovely. The Tour de France just rode through one of the most famous like winemaking regions in all of France today. So the Châteauneuf du Pape. So maybe next year you can head there. So awesome, cool. Well, I think we have a good crew here. We'll get started. We're really excited to be with you all today to talk a little bit about advanced access, what that means, why we care about it, and how you can potentially think about doing this with in your health center with your patients, and really driving improved access in North Carolina. So before we kind of dive in, would love just for each of our panelists, just your name, where you work, and just kind of introduce yourself real quickly so that we can kind of dive in, and then we'll get some agenda.
I'll go first. My name is Ellie Steele, and I am the dental director here at Cabarrus Health Alliance. I know most people who are in the chat right now, so that's a lovely surprise. And yeah, I'm really excited to be working with Matt and Anne for DifferentKind and for growing my program.
Awesome.
All right, I'll go next. I'm Radiant Swanson, the Senior Health Program Manager. I'm with Mecklenburg County's dental program. I also know a lot of you guys in the chat, so it's so exciting to be able to see that you are joining us today. And I am very thankful for Matt and the entire DifferentKind team. It's been going on close to 3 years in working with you guys, and it's been definitely a whole new experience for the county. Especially for our program that has made a lot of changes over the past 3 years. So very excited to be chatting with you guys today and sharing more about my experience.
Awesome. Anne, you want to go next?
Yeah, sure. I'm Anne Cataret. I'm the Executive Director of Advancing Oral Health and the Safety Net, and really excited to be working on this project with DifferentKind.
Awesome. And Deja, how about you?
Hi, everybody. I'm with the Blue Cross North Carolina Foundation, and we are helping to support some of the work that Radiance and Ellie are doing with Different Kind, and are really excited to share more about their progress.
Awesome. Well, we're super excited to be here. In terms of agenda, we'll kind of go through a little bit of why we are even thinking about advanced access, and some of the work that's been done over the past few years and what we learned from some of the data that we saw that we collected during that time that happened during the court initiative in North Carolina. From there, we'll move on to kind of talking a little bit about what advanced access is. Some of you may have some questions about that. So if you do, that's okay. We'll talk a little bit about what that is. And then from there, we'll really talk about, okay, so what is that looking like in North Carolina currently? How are we kind of going about that, and what opportunities might there be for you to be involved in the work that's currently happening? So that's our agenda today. We will have some time for questions at the end. This is being recorded. We will share it with you all at the end as well. So if you have someone who couldn't make it today and you want to share that with them, feel free to do so. All right, I'm going to share my screen here and we will get started. So for those of you who don't know, I didn't introduce myself. I'm Matt Allen. I'm the CEO and co-founder of DifferentKind. We help dental practices and dental organizations collect patient experience and outcome data and use that to drive transformation of your organization. I am a dentist. I worked in a federally qualified health center, so have a lot of experience actually doing this work as well. So like I just mentioned, just a little bit about us. We help you collect patient experience data in an automated fashion, gives you that, immediate feedback, helps you drive action and, connected to your PMS. So it's not something that you have to really work hard to collect. The data is just there, which we all love. We don't want one more thing of trying to work to collect data. We also actually collect employee experience data as well, because we know it's really hard to provide great patient experience if you don't actually care about your employees and have stability within your team and whatnot. And so we do that as well within our platform. So I want to first talk a little bit about the work that's happened over the past couple of years. And Deja, I'll kind of tap you a little bit here as well. So for the past couple of years in North Carolina, for those of you who have kind of been paying attention to oral health initiatives in the state, you're probably aware of COURT. So our friends at CareQuest, started this program in partnership in North Carolina with Blue Cross Blue Shield and FHLI in North Carolina. And so really focused on, supporting both minimally invasive care, alternative care models, as well as quality improvement in general. So Deja, anything that you want to add here in terms of, hey, this is, why as, BCBS, Foundation in North Carolina, we chose to participate in this, why we thought it was a good initiative for the state. You obviously, had such a close role in this work. So I'd be curious to hear a little bit more from you about.
Yeah, sure. So, thinking about our role in this work, and just our role in the field generally, we are always trying to support convenient collaboration between folks, whether that be providers or community or whoever it is. And this, the court initiative was a really great opportunity for us to be able to support that related to this minimally invasive care, patient-centered care, right? It allowed us to be able to support a group of providers to really become kind of our local subject matter experts in a way on like how you start to implement this work, and also created a feedback loop, right, of the challenges that come along with implementing this work in a system that's maybe not exactly built for it. So the really exciting thing now that we get to do now the court initiative is over is think about, okay, well, what do we do now that we have all of this information? And so that is kind of where this work, this advanced access principles work, has kind of bubbled up. And then there are some other ways in which that is bubbling up too as a response to many of the things we've learned during the court initiative. If anyone is interested, I actually just pulled up the impact report. It just came out last month related to the North Carolina Court Initiative. So I'll pop the link to that in the chat if you're interested in learning more to get a little background context.
Please do. I just added this slide in this morning, Deja, so you didn't have it in your draft slides, but that's a perfect cue up there for the impact report that did just come out very recently. So if you're interested in learning more about that, But yeah, I think one of the things that we saw, right, was that, you know, the actual kind of change theme, so minimally invasive care, teledentistry, you know, the things that Ellie and Radiance and the other, you know, organizations who are a part of the court initiative were working on still required data, still required, you know, these kinds of quality improvement methodology kind of ways of thinking about the world that certainly when we think about patient experience, there's a lot of that same kind of thinking and application. And so really being able to have all of this be related to each other, not just to say, hey, we're going to improve our sealant rates or we're going to improve, you know, our silver diamine fluoride rates, but we're also going to make sure that we are, you know, thinking about being empathetic with patients, and we're going to think about access, and we're going to think about price transparency with our patients. So all of that kind of looping in together. And so in that impact report, you'll see from DifferentKind's perspective how we supported some of this work. And this is what we saw over the course of the court clinics over time when we focus on patient experience. So we collect 14 different metrics and we roll that up into one kind of big, what we call DK score. And essentially, like, we see a pretty significant improvement over the course of time when these organizations were paying attention and working on improving patient experience in their individual settings, which is absolutely wonderful. Another one of the things that we did see, and we already talked here about this impact report that Deja just mentioned. So you can see here the data of the 14 different metrics that we collect. So empathy, patient consideration, office environment, you know, all really high, which is great. But we can see down here, ease of access and price transparency were our two lowest metrics. And ease of access consistently came up as one of the things where it felt like patients were just not able to get in. And what that means, I think, for them in terms of, because we collect narrative feedback as well, was, hey, I finally got an appointment after waiting for a really long time, and now I have to wait 4 months or 6 months or something to schedule my next appointment, and I need a filling, and then now that's going to become a, you know, endo. They're not saying that, but we know that, right? And so that's a big problem when, yes, maybe a patient gets an appointment, but they actually can't, you know, return for a follow-up visit. So with that, I actually want to ask a question here. Let me pull this up. So if you are in a health center and work in a health center and see patients, or, you know, are part of the patient care process, just kind of want to get your, you know, have you assess your own access. So on average, how long do patients have to wait before making their next appointment in your setting? Is it less than 1 week, less than 2 weeks, less than a month, less than 2 months, or more than 2 months? Go ahead and just answer that if you would be willing to share with us. We'll leave it open for a few minutes here, or a few, you know, maybe 30 seconds, not a few minutes, but, and I know all of you aren't necessarily, you know, in direct patient care settings, so no worries if you're not. Just kind of want to get a good sense here of what this looks like and where we're at for a lot of folks. All right, so we have a pretty good chunk of people. Give you 5 more seconds. If you really want to click a button, go for it. All right, seems like we're pretty good. I'm going to end the poll here. So you can see the results here. So less than 1 week, no one responded to that. Less than 2 weeks, one person. So we kind of have a bell curve that's probably somewhere between a month and 2 months, you know, is kind of the average for what it takes for someone to come back, with a few people reporting kind of more than 2 months. So I think this will be a good group for us to talk about advanced access and what that means and why it looks that way. So thank you for sharing where you're at with us. We really appreciate it. Okay, so diving back in here. So this is not only a problem for the folks that participated in the court initiative, the ease of access piece, but what happens then, actually, what we see, so we actually collect outcome data as well. So these are patient-reported outcomes of appearance, function, overall oral health, and pain. And what we see is that the line still is increasing here, but it's not increasing at the same rate. So we can provide a great patient experience, but if we're not truly making patients healthier in a meaningful way and really driving this, and for a long time, actually, when we look at the data here, and you can look at the green line here, which is overall oral health, tends to be the lowest of all of these 4 metrics. So it's one of the things that we noticed is that overall oral health does not always seem to just be a, you know, addition function of appearance, function, and pain. People still feel like, hey, my overall oral health isn't great, even if I am okay with my appearance and I, you know, think I can function in some of those things. That's an interesting psychological phenomenon that we're seeing there. But if we look, you know, we have a few high data points here at the end, but like, let's say we stopped in August, right? That line actually might be pretty flat. And so we're not increasing overall oral health at the same rate as experience is increasing, meaning that people can get in, they have a good experience, but they can't actually get back all the time and get the oral health outcomes that they want for some of the reasons that we're seeing in terms of access. And so what we thought about then was, okay, so how do we solve that problem? How do we help outcomes increase at the same rate? How do we help all of these organizations increase treatment completion, et cetera? And that's really where advanced access comes in. So I'm going to kick it over to Anne. She's going to walk through the next few slides here, just in terms of a little bit about advanced access, what it is, and how we think about it. And then we'll kind of dive back in with Radiance and Ellie talking a little bit more about their experience here.
Okay, so one of the things that we want to talk about, in terms of patient experience for advanced access scheduling is really, what is the wait time for the next appointment for patients to be able to get in? And these are two metrics, right, Matt, that DifferentKind looks at: the wait time for the next appointment and then the wait time in the clinic after check-in. So those are kind of part of the patient experience. You can go to the next slide.
Well, and just to add on to that too, so you can see number 7 here where it says wait time, right? So that wait time, once you get in the clinic, you get an appointment, you're like, great, my wait time is good. But that kind of ease of access piece is more the like, how long does it take me to get to that next appointment piece? And so what we see here, right, is there are two different metrics of how long do you wait once you're in the clinic, but how long does it take you to get into the clinic in the first place? And that's, exactly. And so keep going.
All right. So advanced access scheduling is something that, we've really tried to implement. I think now more than ever, it's probably more, important in thinking about, the access and the amount of capacity that we have in our health center programs, and really thinking about, how can we provide, more capacity, more access with fewer workforce, and more demand on us than ever before. So advanced access scheduling is really patient driven. So really thinking about, having the patient in mind and making sure that they can be provided care within a certain amount of time, right? So we know that scheduling them too far out really just, puts them in a more unstable oral health environment. So really trying to get them in as quickly as possible. It's a system of scheduling that minimizes the appointments scheduled that are scheduled more than 2 to 4 weeks out in advance. So we try to get it within that 2 to 4 weeks. It's really a modern approach to dental access. As I had said, they've actually been doing this in medical for quite a while. It's really most successful, as many of these types of projects are, when it's carefully planned, kind of looking at a lot of different metrics, a lot of data, talking to leadership, to kind of those people who will be those like clinic champions who will kind of be in charge of advanced access scheduling. Thinking about, the team, the resources, what we have as part of the team to kind of implement advanced access scheduling. I think the most important part, as I had mentioned before, is this: it's really patient-centered. I know people talk a lot about patient-centered, but I think there was more conversation about patient-centric care and, less action. And really the advanced access scheduling really provides that actionable patient centered care for them. There's a lot of different variations. So kind of going back to the success in planning it, it's really program specific, if you will. There's like the big idea of making sure that we're opening up time in our schedule. So it's not so rigid for certain visit types, but having more of an open schedule. But there's a lot of different variations of advanced access scheduling that we can provide. Go ahead, Matt.
Yep.
So there's always benefits and limitations to everything. So some of the benefits to advanced access scheduling is reducing the scheduling wait time for patients. I think that's positive not only for our patients, but honestly for our providers as well. Nothing feels worse as a provider when you're sending a patient on their way, when you know that they have active, oral health disease that really needs to be taken care of. Also limiting the amount of no-shows. So there's, it's been shown that and proven that we have quite a bit of reduction in the no-show rate or the broken appointment rate when we provide or we implement advanced access scheduling. So we have an increase in patient volume, an increase in provider productivity, all really positive things, especially thinking about, I think the clinical piece and the operational portion is one thing, but we always have to think about finance. And so we want to make sure that we're kind of meeting mission with margin and keeping our doors open. So that's how we can continue to provide access and really patient-centered care, is by keeping the doors open in terms of the finance piece too. Oh, sorry, I don't know if you can hear that or not. Decrease in urgent and emergency care, which is big because we're able to get our patients back in a timely manner, and flexibility for staffing issues. So kind of figuring out what those visits will look like, what the days will look like for the providers. Good. Potential drawbacks, patient and staffs are not used to advanced access scheduling, so having a more kind of open schedule for this. Looking at metrics, that's really key to be able to understand, where you're starting and where you need to go, and are we getting to those places? So balancing supply and demand is always a big one, and it always feels, especially I think within the last 5 years, that we have more demand and less supply, whether that's a workforce shortage, just more patients that need care. Maybe they've lost jobs or anything like that. We have some upcoming possible changes to Medicaid, or a reduction in, beneficiaries for Medicaid. So what will that look like as well? There's typically a lot of phone calls, I think, not only questions from patients of when we can get in, but now we're not scheduling them out as far. So we're asking them to call in to see what's available in our schedule if we're not able to schedule them as they're leaving. And it gives us an opportunity to kind of shape that demand, and what does that look like in terms of provider productivity, and kind of, shaping what that schedule looks like. Go ahead, Matt. So this is just really a case study. We're just calling it ABC, FQHC dental program of a multi-location federally qualified health center, had 6 FTE dentists, a residency program, 2 specialists, and the no-show rate was between 22 and 45%. Next slide. Okay. So there really was, there was a lot of patient access, or there was a lack of patient access to dental care. So there were really long wait times for the dental appointments, especially when looking at restorative, endo or root canal therapy, oral surgery. Those are always in really high demand. So, when we have long wait times for that, we know we're pushing out that really important care even further. So the key metrics that we looked at for each site and populations that we focused on were the number of days to the next dental appointment or restorative appointment at each of the sites, the number of days for the next hygiene appointment. So we also, I didn't say this in the beginning, but we also include this in hygiene. I think this is, in thinking about kind of staff feedback, this is also very difficult for hygienists, because we're used to being able to schedule either 3 months or 4 months for our perio patients, or every 6 months for our hygiene patients. So kind of getting used to not scheduling out so far for those, and what does that look like? The number of days for the new patient appointments. So when can we get those brand new patients into the schedule? We know that we have a really high demand of new patients. And even for, both, we want to make sure that we're providing access and equal access for both adult patients and our children. So another initiatives and policies that impact access are the expansion of sites and Medicaid, adding providers and specialists and residents. That's all a big piece of, what does that access look like? We know some residency programs can kind of drag on the schedule, and some of them, that are really well refined and well-running machines, we provide even more access with residency programs. And then local partnerships. Next slide. So the tools that were developed together in this FQHC program, it really reflects on the community, geographic locations, like taking into consideration all of those pieces of it. The team, this is a big piece. I think, no matter what you're implementing, I think that the asking your team, but both leadership and your clinicians, I think everybody should have a voice to this, kind of understanding what we're asking them to do and think about these processes as we implement them. You can't get people to sign on with these things unless they're part of that conversation. What are the leadership priorities? What does the mission look like? What do the values look like? And if they're very used to having, the way we have typically scheduled in dental, that schedule template and the visit type, kind of providing additional information and description of what this looks like, what it can look like, and making sure that our leadership is on board with that. The consideration of existing resources, especially in terms of, we know that there's a lot of turnover in front desk. Do we have front desk champions? Do we have clinical champions in the back who are all on board with this? And measuring what it looks like. So again, as I had explained, you want to know where you are today, where you want to go. And then, while you're implementing this and following this, is where are you going? So really kind of having those metrics and the ways to measure all of that. So we not only need the metrics, but we need the know-how of how we pull that data out of our system to even understand those metrics that we're following. Next.
Awesome. So all this happens at ABC, and what do we get?
So a reduction in the broken appointment rate. I think it was around 23 to 45% to 10 to 15% broken appointment rate, and still holding on 3 years later.
Awesome. So this is one example of some of the work where advanced access principles were implemented and some of the success that they have seen. Luckily, we have a few folks here who are going to tell us about their experience already doing some of this work and what they've learned. So, Anne, thank you so much for kind of giving us a primer on advanced access in general. After court, we saw that data. We said, okay, great. We think advanced access is going to work here. And so really what we're doing currently is applying advanced access principles in combination with these patient-reported experience and outcome metrics to improve access and oral health in North Carolina. That is the work that Deja was mentioning earlier when she was saying, cool, this is what we saw. This is the next step for us. And so we have a few aims as a part of that program. So number one is to help clinics transition to operational structures that support advanced access principles. There is certainly operational work that has to happen to make this work a reality. You can't just say, oh, I want advanced access, let's do it, and the next day go live. It takes a little while of planning and kind of thinking and talking and getting everyone on board. So this is the first aim. The second aim is to then actually improve the patient-reported outcome metrics for returning patients. So for patients that are coming back, can we actually help them get healthier and make sure that we're completing the treatment that they have out there and their oral health is improving? And then lastly, for North Carolina in general, we want to create sustainability resources and materials to help both the BCBS and North Carolina Foundation champion and market this work beyond this project so that North Carolina can become a state that everyone looks at and says, hey, if you need to think about how to do access in health centers, North Carolina is the place to go. That is certainly something that I was chatting with the NOAA president recently. And she's like, I would love for you all to present this work at a future conference and help us to understand, on a broader level what this can look like. So we want to help, really create champions and sustainability resources in North Carolina around this. Two of those people that are here today with us. So Cabarrus Health Alliance, Mecklenburg County Dental Department, Ellie and Radiance. I'm so happy that you are with us and you have both been on the court journey and are now on this advanced access journey. So I want to spend a good chunk of time kind of just facilitating a conversation with the two of you and getting your perspective, because I think your perspective is certainly the one that matters, because you're the ones who are doing this work actively. So I have some questions, give you some open opportunity to answer those. If you have any questions for Ellie or Radiance as we're going about this, feel free to put them into the chat. I will try to make sure that I am monitoring that as well. So I think, first question here, Ellie and Radiance, they're coming together. So 2 questions. We'll go with just the first one here. Tell us a little bit about your dental program, because I think you both have different programs. And as Anne mentioned, a lot of this work tends to be program specific. So I think it's helpful to start there. Give us a little bit of background on Cabarrus and Mecklenburg.
Okay, so the fun thing about us is that we are next door neighbors. Cabarrus County and Mecklenburg County, we are really close together, but we have very different programs, like Matt was alluding to. Our health department, we have 2 fixed sites for our dental clinics, and we have been seeing adults for emergencies and some adults for comprehensive care since we opened, or at least for the past 20 years. However, we've seen increased demand, especially for adult patients, especially as Medicaid expansion took place. And so that was one of our priority areas that we've been trying to get to for the past decade, is to be able to serve more adults. We currently have 5 dentists. We'll have 6 soon, 9 public health dental hygienists, and an incredible team of 14 dental assistants. We use a lot of remote supervision. Our DA2s do a lot of coronal polishing, and everybody working at the top of their license. And then we also go out into the schools. So we have a lot of moving pieces and a team that is expected to go, expected to adapt depending on what the day's journey brings us.
Radiance, what about you?
I'll follow up there. So like Ellie mentioned, the Mecklenburg County Health Department is pretty close by to Cabarrus Health, but we are completely different. So we actually, for the past 25 years, have been serving the pediatric community. So we have 1 brick and mortar site where we have 3 full-time dentists, 6 dental assistants. And in our pediatric dental clinic, we serve, like I mentioned, the children, and we offer comprehensive dental services. We do have 2 additional programs within Mecklenburg County. We have our school oral health program, where we have 3 dental public health hygienists that go through the county schools. We have about 180 schools that we do screenings and educations to throughout the school year. And if there's any children that are screening outside normal limits, they are referred to our brick and mortar. So that is pretty much the way that our patients usually reach access to our clinic, is through our school oral health program. And then this past year, we recently launched our mobile dental program. So we have a brand new dental mobile unit that goes through the schools and offer our preventative services on site. And then we welcome those children back to the clinic with their parents, and we offer our comprehensive services. We are working right now with new leadership within Mecklenburg County. We recently just received a new county manager, and the goal is that our dental clinic within the next 3 to 5 years will look at expanding our services to adult dental. So we do have some adult programs that we're piloting, and Matt's thumbing up because he knows like this is something that's been on the horizon, and we're so excited because we are going to use our mobile unit to pilot some of our adult dental care, so that when we do move to our brand new dental clinic within the next 3 years, we can renovate this clinic and turn it into adult dental clinic. So lots going on in Mecklenburg County, and it was really helpful for us, which I'll share once Ellie shares her experience, how Court and DifferentKind was able to provide that support for us in redefining what our program goals are.
Awesome. I'm going to stop sharing because we're just going to ask some questions, and it's great better to see your face than it is to just look at some words on a screen here. So yeah, so Radiance, why don't we start with you there, since you just mentioned it. We'll just keep with you here. We don't have to go in order always, right? So what was your experience in Court, and then why did you choose to participate kind of in this advanced access work? Kind of answer the question that you just so elegantly posed for us.
Thank you, Matt. So I recently joined the county 3 years ago. I've been working with Deja and Matt for quite some time, like I mentioned. And one thing I realized that our program was pretty archaic. So it's been running for 25 years, but nothing has changed. In what we did, we really just stick to the basics, kept it black and white. And the things that was concerning to me was the environment was changing, but the program wasn't. So one reason that I decided to join court was to kind of figure out like, what is dental public health looking like right now? What are other programs doing, just to make sure that we're keeping up with the current environment? And I realized really quick we wasn't. So part of that was a lot of like what we talked about, like the aim of there was operational changes that had to take place. Like advanced access scheduling sounds really great, but if you do not have a infrastructure prepared for that, it can be pretty harmful to the organization itself. So we had to do a lot of the groundwork with court, and that's how Ellie and I actually became friends. The great thing about having those conversations in other organizations, and reasons why webinars like this is pretty helpful, is because sometimes we tend to look at things one way, and hearing how another program is tackling the same concerns that we may be experiencing, it was pretty helpful. So we had to redefine what patient care was. We had patients that have access to internet services. We have patients that did not have access. We have patients that spoke different languages. And we realized that we needed to increase the staffing to be able to support the community. So that was the first thing. Like with advanced access care, it will be great if you can offer care, but if you don't have individuals to offer that care, that's pretty concerning in itself. So we went from 1.5 dentists, because one was on its one was retiring, to 3 full-time dentists. So that was the first thing I started to be able to increase the patient appointments. And through feedback, because what Matt talked about is we were able to see real-time patients' feedback about the care that we were providing to them. I realized that we were scoring a little bit lower than expected as far as like culture sensitivity and fee transparency. So to be completely honest with you guys, we went from appointments being about 45 minutes to an hour. Now, this might not work for every organization, but it best worked for us. Individuals that come to our clinic, this is probably the first time they've ever stepped into a dental clinic. So we needed to spend more time with them to just make sure that they fully understand the information that we were sharing with them. Because what we noticed that was we were recommending treatments, scheduling them, but then they weren't coming back. So I don't want to go too far down, because I know like I'm going to share them.
We have more questions. Yeah, we got more questions. You're doing
We
great.
have questions and stuff, but the moral of the story is we wanted to make sure that we focused on the infrastructure changes first, get staffing to where we needed to be, and then also look at the change management, which, as you may already guess, people that have been working for 25 years doing things one particular way, I won't say it was an easy journey for them, but that was the great thing about just having those data to back up, to be able to reflect on. Like, it's not a me thing. I know I'm new here, but this is what our patients are saying. So we really need to make that change.
Love it. Ellie, yeah, thank you, Radiance, for sharing. It's really a great journey there. Ellie, tell us a little bit about, why you participated in court, and what made you kind of say yes to advanced access work in Cabarrus.
I think the first thing that I want to note is that the advanced access still throws me off, because I feel like it should be called like non-advanced access, because I still am confused about that. So just wanted to put that out there if anybody else is having the issue where you are scheduling super, super far in advance. As our practices have grown, we now serve almost 10,000. Actually, we do serve 10,000 unique patients per year in our dental clinics altogether. And with that, we also are seeing so many more needs for those gum treatments, especially we're doing SRPs on teenagers now sometimes. And it's really hard when you talk to a parent or a patient and they become motivated to then be like, actually, well, our next hygiene appointment is 8 months out. And that's what we were running into over and over again, where I felt like we were doing everything right. We are hiring more hygienists. We are hiring more dental assistants. We are hiring more support staff and dentists, training staffs, and we still were booked so far in advance, and so annoyed when patients who were taking those important blocks were not showing up to their appointments. And so while the patients were definitely frustrated by that, we were frustrated by it as well, because we're like, we know we can see more patients. We know we can be more efficient. We know we can serve these people in a way that they want to be served. And we also realize that knowing what your schedule on a Friday 8 months from now is a little difficult. And so we actually made the switch after going through like court feedback, our patient surveys, and again, this frustration that we all felt to say, okay, we're done scheduling 6-month recalls in advance because we're scheduling 8-month recalls to begin with. And we are also not able to adjust our schedule as needed based on school scheduling, based on staff vacations, based on what our patients need. We were also doing surveys with our staff like, hey, what templates are we putting here? Is 60 minutes enough? What else are we seeing? And we just kept getting feedback over and over again that the changes we were making were taking too long to have an effect. And so again, we want to keep our staff are absolutely incredible. And we don't want to lose somebody because, oh, we made that adjustment, but 8 months is too far to wait to feel that change. So that was a big driver for us, was not just the patient-centered aspect, but our staff feedback. And we really got that through like taking the time with court to do a lot more training on, team building, on patient interactions, on follow-up to those high-risk patients. And it really just led us to saying, okay, well, this isn't working. We're going to stop. We're going to lean into some technology, and we're going to make it possible to really focus on what the patients keep telling us.
Ellie, that great answer there that I think was one of the next questions that I had. So, and I have a follow-up question to that. So one of my questions for you both was, what steps have you already taken, right? So this is a journey, and there are moments where you go live with something, and you mentioned like, hey, we're going to stop scheduling 6 months out. Tell me a little bit about like what was easy about that, what was hard about that, and what have you already seen? Because it's been more than 6 months since you've done that. So these patients who would be coming back for recalls now are coming back differently, or so tell us just a little bit about what you've learned based on what you've already done.
Yeah. So we stopped scheduling our 6-month recalls at the end of October last year. So we are feeling that difference, and it is lovely. I highly recommend it for anybody who's having that same hygiene problem, like we were. We are still scheduling out for adults a good 4 to 6 weeks, and some of those appointments are out further, but we are seeing patients with SRPs get all 4 quadrants done in less than 2 months, which is something that would never have been possible a year ago. We are also able to reschedule less patients because by making the templates or opening up schedules it's still open about 6 to 8 weeks in advance. But by closing on that much, I have my leave requests and vacation and maternity leaves and all these other things to work into the schedule. I also know when we're going out to the schools. And so it makes it a lot easier to not have to reschedule patients and only say, yeah, these are the openings we have. If we get more, we can send out an ASAP text, but this is what we got going on right now. I'm looking forward to seeing what our data really shows with our no-show rates for hygiene in particular. I don't have that answer for you right now.
It's early journey. Yeah, we're still in process. So we'll talk about that in a minute here. Radiance, what have you already done? What have you learned? From that, what's been easy, what's been hard? Give us a bit more about your journeys thus far.
Yeah, so as you can imagine, launching a new mobile program and being able to increase access to care for those that generally never had an opportunity to be able to have that access, we noticed that we had an uptick in the amount of patients that needed treatment. So we're going into the schools, we're doing the preventative work. Okay, we've already cleaned the child, now we need a spot to be able to provide that comprehensive care. So what we did internally was try to be able to determine what days can we accommodate more patients, what days we were blocking off columns that we can be able to open up so that we can increase access. So we do go to the OR 3 times a month, and generally once that doctor was out, we kind of closed their columns down and the doctor would go to the OR with their assistants. But what we realized in just having conversations with the other providers that would have still be in the brick and mortar, they were okay with having an additional hygiene column that they can manage. So generally each provider has 2 columns, but we were able as a team, just understanding the need for additional appointments, was able to open additionally 8 appointments per doctor. So essentially a doctor will be able to take on 8 more patients within that particular day, but just offering hygiene checks So like Ellie mentioned, we do have our dental assistants that are working to the top of their license. Because we're still serving a pediatric community, those assistants are taking care of the corona polishing, a lot of the patient education. So it's not more stress on the provider. They're just coming in, they're providing those hygiene checks. And these are for patients that already have completed treatment and they're just really coming in for their routine care. For the patients that have been here or have not been here for a long time, missed their appointments, or a new patient, they're in the provider's main column. But that ability for us to be able to open up those additional appointment slots just really was allowing us to be able to see more patients, understanding the demand within the schools. So as Ellie mentioned, this is a collaborative effort. As a supervisor and a leader, you don't just want to come back and be like, this is this decision I came up with, we're going to do it. Like, we want to sit down and we literally use the data from DifferentKind. Like, we saw what the patients were writing in their testimonies. We saw how they were feeling in terms of like next available appointments. So having that in front of you was pretty helpful in the providers having a conversation amongst themselves, like what things can we do internally to be able to increase the appointments. So that was something that we took advantage of. And we are continuing to look at other ways that we can be able to allow current staff members to work at the top of their license. Like, we have school hygienists that are just pretty much focusing on screenings and educations, but we're working on finding different ways we can incorporate them into the brick and mortar so that they can also see additional patients as well.
Awesome. Thank you so much. I love that both of you have touched on a couple of the things that I think are really important in advanced access scheduling in general, right? So one of those is just provider columns and like what those columns look like, and, you know, just the templates, right, that we're looking at. And Radiance, you're talking about like, hey, we were able to add columns, and, you know, like, and Ellie, you touched on that as well in terms of like, hey, we know now like when someone's going to be out. So those columns were never open to begin with, right? Like, just what do those templates look like? And then I think you've both touched on this as well, is there's this kind of like openness to like what actually goes in those templates, that is not, you know, always as strict as what maybe dentists have wanted in the past, let's say, of like, I want a 20-minute visit at this time with this kind of patient, you know, on Friday afternoons at 3 p.m. And you're like, great, well, if we don't have that, then like that's just a wasted slot that now we can't use for anyone else, right? And so, you know, both how do we structure the templates, what goes into the templates when they are structured that way. I think you're both, you know, taking active steps to work on that. And I think one of the things, I'm going to share my screen again here as we kind of go, you know, kind of, and I know everyone's on lunchtime in North Carolina, so I want to make sure that we give you time to go back to work and do the things here. So make sure we stay on time. Is that you've both mentioned this takes time, right? Ellie, you talked about the fact that, you know, in October, you stopped scheduling 6 months out, right? And so you're talking about having these conversations. And so as a part of this work, like, we have finished or are just finishing phase 1, which is really this operational discovery with both of your clinics, kind of understanding where you're at, where you want to be, right? And that's taken months. That's not something that happens in 3 weeks. It's taken months. We're moving into phase 2, which is going to take another big chunk of time, probably 6 to 8 months, really, in terms of like planning and go live on some of the next changes that you're planning on making. And then lastly, like, what does the sustainability look like? How do we measure that moving forward? And that's a large chunk of time as well. So this is something that, you know, we don't want to try to shove into, you know, a 3 or a 6 month window. We want to try to provide, you know, you with the time to actually make these changes over the course of time, to have those conversations, to see what the data says, to make changes, you know, based on that. So it is not certainly something that has happened overnight, and you've both done a great job, I think, of explaining what you're already doing, what you want to do, and where you hope your health center is going. So thank you both for giving us such a deep insight into your clinic. And it's cool to see two very different, you know, organizations that are really close together, that have different, you know, operational structures, both being able to, you know, say, okay, cool, there are things that we can do. And so my encouragement, I think, to all of, you know, the folks on this call is that you might look different than Radiance, and you might look different than Ellie in terms of what your program does and offers and has. And you too probably can do some of these, because ultimately we want to make this impact where, you know, we will show that improved access ultimately leads to improved outcomes, and that we can go tell the world about this at, NOAA meetings or like NOHC meetings or whatever it might be. So we would love for you to be a part of this work. I know Radiance has kind of mentioned this, and it's great to do this as a team. And so our call to action for you, if you're still with us here, and you would be interested in learning more about participating in this initiative, we do have space and time to actually add folks to this initiative. And so whether that is, hey, we're ready to do it tomorrow or ready to do it in the next couple of months, we would love to talk to you more. So please feel free to email me at matt@differentkind.com if that is you. We would love to chat more with you. What questions might you have? And then we'll certainly give Radiance and Ellie and Anne and Deja a chance to kind of share any closing thoughts with us here as we send you all back to your regularly scheduled programming. I did see one Q&A. Where did it go? From Jennifer. Thank you for sharing that. Not on the scheduling subject, but huge need for dentists just to see more Medicaid in general. 100%. Like, what does the fees look like? Yes. I know a lot of great work is happening in North Carolina around just the advocacy and kind of building dentists even within the schools to come out and be prepared to take care of these patients. So I know North Carolina is doing a lot of great things. But yes, Jennifer, I appreciate your comment there. Thank you for sharing. Anyone else have any questions? Feel free to chat it in. Feel free to use the Q&A function. If not, or as those come in, we certainly can answer them. Radiance, Ellie, and Deja, would love, just your closing thoughts. Take us home here. What's one or two things that has stood out to you today, both from listening to the other panelists as well as maybe just encouragement for the folks that are on the webinar?
Yeah, I will go here. So I think what's pretty intriguing to me is the approach that Ellie took in not scheduling the next 6 months. That was something that we historically was doing, and we're starting to see a difference, especially when it comes down to confirmation, if they actually will still stay there. We do still have availabilities with the next 6 months. So it would be, if we pull that back, it more so would be just to ensure that we're not having like these patients hold up space on a calendar if that date no longer works for them. So I realize that there is an increased need for providers, especially now with a lot of the changes within Medicaid. There's a lot of providers that are either adding Medicaid to their portfolio or taking it out. And so we do want to be able to be a little bit more accessible to the community. So I am actually curious to kind of continue to track Ellie's progress with that, because we don't want to have a schedule full of patients and then we go to confirm, they kind of fall off and we're building up the schedule again when we could have offered those slots to other individuals that were interested into a more closer appointment. So I'm intrigued by that. So thank you, Ellie, for sharing that, and I will be keeping up with you.
Thanks, Radiance.
Oh, sorry, Ellie. Go ahead.
I'm sorry, just to piggyback off that a little bit. I think one of the hardest things for me is that I don't have all the ideas. I don't know how other places work. I learn from like this group and everything, but it's really nice to have data to support some of the decisions that I want to make or that I've made. And I'm saying, hey, look at this a year later. I also think it's important for staff to see, hey, we're making progress. We're trying to address your concerns, because even if they hear us saying that is a problem, let's try this instead, there's a lot more willingness to, stay with us. I think we can take it. I'm looking at different strategies for how to take it even further, just because we are doing text messages, we're doing emails, we're doing calls, we're doing all these things. And we still have patients who say, yes, I'm coming, and then don't show up. And so again, there's a lot of different strategies to try. And I'm excited to have the data to track those strategies that we are trying.
Awesome. We have a good question from Halcyon here. How do you tackle capacity issues? Do you have long wait lists? It's a great question in terms of how do we think about this from advanced access? Ellie, Radiance, certainly feel free to chime in here. I will say as well here, one of the things that I think we didn't touch a ton on, but I think we've heard from both of these programs, is that there is a specific focus to both of your programs in terms of Radiance. You're saying like, hey, we say yes to all pediatric patients. Like, that's just what we do, which means that there's exclusions. And I think sometimes when we have to say no to folks, it feels bad, but it means we can say yes to other people. But if we try to say yes to everyone, then we're really saying no to everyone. And so ultimately, I think that one of the issues there is like, what are those populations that you do want to focus on within your health center? Whether that's pregnant women, whether that's kids, whether that's diabetic patients, whether that's patients with Alzheimer's disease or head and neck radiation therapy or whatever it might be, to say, hey, these are the patients that we're just going to say yes to and we're going to figure it out, versus, hey, here are the other patients that we can't say yes to for comprehensive care in this way. And that's just going to mean that we're going to be able to finish the treatment for these other folks instead of having everyone, not get to oral health. So that's just my thought in general here. It's a hard thing to wrap our heads around, but I do think once we help our staff realize that, sometimes it feels better, because you're like, well, we can't make anyone healthy, or we can make some people, healthy. We should do we should do that latter. And they're like, oh yeah, that makes sense. So Ellie, Radiance, any thoughts there in terms of tackling capacity and wait lists?
I think, Matt, you hit the nail on the head. I think it's really important to be able to determine what your target population is and kind of stick to it. Because remember, it's a large community in itself. And we in Mecklenburg County, we serve as a safety net. So our goal is really to be that safety net for those that need care. At times, we sometimes end up to get a lot of individuals that want second opinions, which is great, but we do have to prioritize the individuals we're serving. So I shared with you guys that we really get a lot of our patients coming from the schools. So these are children that were screened, have abscess, infections, just like significant issues. And so that is important to us to be able to offer care to them, not only in a timely fashion, but as quickly as possible. So we do have to make sure that we leave a lot of our room on our schedule available for those particular patients that are coming and being referred by the schools. And then on top of that, one of your questions was, how do you tackle capacity issues? We don't want to create burnout. Like Ellie said, North Carolina itself hit a really hard place in terms of staffing shortages across dental agencies. We're fully staffed. I'm going to knock on wood. And so one thing that we try to make sure that we prioritize is just not causing burnout amongst the staff members, which is why I said if we open columns, we do have particular appointments, not as persnickety, but it's like, we're going to have routine here and here. We're not going to throw an emergency into that slot. So a provider is trying to offer treatment here, emergencies there. And then do we have a long wait list? Actually, we don't, because as I mentioned, we've identified what our target population is. We create appointments available for them. And if we do get calls from individual asking for second opinions, we want to make sure that we offer them as much advice, but we do share with them like, hey, this clinic might not be the best clinic for you for a second opinion, but we do have some recommendations. So if you have a pen and paper, we'll share with you some other clinics that you can reach out, and your partners will love for you to be able to fill their slots, and because productivity is important for them as well. So just really owning what your target population is and making sure that you don't veer off, because too many patients might be a concern, because you're accepting all these patients, but when are you going to treat them? That's really the important part.
Love it. Well, that's a great answer, Radiance. Ellie, unless you have anything to add to that, I just want to make sure we stay on time here. Great question from Becky in terms of sharing resources for the front desk team to help screen calls, to prioritize population and focus patients. Yes, certainly we can share some additional resources, and certainly, Becky, feel free to reach out. I'm sure that, both, Ellie, Radiance, whoever it might be, we have some resources as well. But yeah, happy to share some of those things. So, Anne, anything that stood out to you, closing thought here before we say goodbye to everyone?
Yeah, I was just thinking, as a former dental hygienist who practices once in a while, I do, and it's something that I've talked about a lot in the last decade or so, that I've been kind of doing this type of work with consulting, and how can we create more capacity is that hygiene visit and not scheduling that out. So I think that's a really big one. I think not only not scheduling out, but figuring out how to pull that specific data, to show, our providers as well, who are a little unsure whether that will work, and we're like so used to this, but also to show the rest of the country who is also worried about, these hygiene visits, and we have to get them in. So I'm really impressed with that, and I would love to work with you on that to how do we pull out just those hygiene visits. The other thing is I love how both of your programs have the flexibility to try new things. I think it's really important for all programs. If something isn't working, to not continue to do the same things, but step back and say, what are these things that we can do? So I commend you and your providers and staff and leadership to take the chances to try these things. And I think it's important as well. You know, like Matt talked about, these projects take a long time, and it's for a reason, because it takes a while to implement things and then to see how it's going, to make sure your patients are comfortable, your staff is comfortable. So following this data over a year, 18 months, however long it takes to really see what those changes are. Changes definitely don't happen overnight. So I really appreciate the flexibility with your programs.
Love it. Deja, take us home. What's your one standout from today? And we will say goodbye to everyone.
Yeah, well, my standout is really the fact that this work can be implemented in different ways in different contexts, depending on what is needed in that context. We heard from Ellie, we heard from Radiance, and they have slightly different contexts, even though they're right next door to each other, basically, in terms of counties. And I think that that's the beauty of this work, that, it doesn't have to be all or nothing. There's a tailored approach that each individual health center can take, that really depends on what they need, what their patients need. And so I, encourage folks to just continue to think about, what does your context say? And as you're thinking about what populations you want to target, how do you look at your data and think about where you really need to hone in? Data-driven decision-making is always really important. And I think that this work continues to support that. So thanks everybody for joining.
Yes, thank you so much. We will follow up. Deja, since you're the one who's been following, sending everyone emails, right? I'm guessing I will probably get this uploaded and then, shared with you so that you can follow up with everyone in terms of the recording. If you have any questions, feel free to reach out to me directly, though, matt@differentkind.com. I can properly route your question to any of our panelists or whatnot. Ellie, thank you for adding in some good chat there at the end as well. We appreciate all of you. Thanks for all the hard work that you're doing in North Carolina to improve the oral health of the patients that you see. It's been lovely to be with you today. Have a great rest of your day, and we will talk to you all soon.